Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and we are getting ready for a great July 4th weekend. And I wanted everyone to have a safe 4th of July. And we are just continuing a segment that we started last time, and I had told you we're going to be talking about this issue of when to choose orthodontics versus cosmetic dentistry. And just to kind of refresh everyone, when I'm talking about cosmetic dentistry, I'm talking about choosing to do veneers or crowns in order to straighten your teeth or improve your smile. And so what we talked about last time was that there's going to be instances where orthodontics is the preferred method of choice, and there's going to be instances where cosmetic dentistry is the preferred method of choice. And then we also said that there's going to be times where a combination of the two treatments is actually going to be warranted. And so today what I wanted to do is kind of bring up one particular issue that I think is going to be very interesting to talk about, and it's when you want to choose between having a crown done or replaced versus actually incorporating orthodontic treatment into it. And so here in this particular example, one of the things that you're going to see is that there's a difference between where the tooth meets the gum tissue here and here. And so when this patient came into our office, their concern was that they needed to have a new crown done and it's really done for cosmetic reasons. They wanted to have they didn't like the color of the crown. Now, if the dentist goes in and just replaces the crown without taking into account where the gum and the tissue meet, where the tooth and the gum tissue meet, then if you really imagine this, if they go and replace this crown as is, then what's going to happen is that you're going to have one really large tooth and one really small tooth. And aesthetically, that won't look good. And depending on how that person smiles, you can end up having, I always joke about this, but you can end up having one tooth look like a horse tooth and one look like a normal tooth. And so in this scenario, one of the things that you can't do with cosmetic dentistry alone is change the gum heights. So one of the things that we would say in this particular case is that if you're really trying to achieve a smile where the gum heights are even or like symmetrical, we're always talking about symmetrical or symmetry, then in this particular scenario, you can't make that change with cosmetic dentistry. So you have to use braces or you have to use Invisalign. So, and the cool part about it is when you move a tooth, the gum tissue moves down and up with the movement of the tooth. And so in this particular scenario, what we did is when we put the braces on, we actually caused this tooth to come down. And you can see in the final picture, after she got her new crown done, the gum heights were there and there. They're actually perfectly even. And so this gum symmetry is only achievable through the use of braces or Invisalign. So when you're talking about that issue as like a complex issue in trying to improve someone's smile, in this particular case, anytime you have these aesthetic gum concerns, then the likelihood is more likely you should actually choose to do a combination of orthodontics first and then do the replacement of the crown. And so that's what we did in this case, and that's how we ended up getting a really great symmetry to the smile. And because when this person smiles, they show the gum tissue, so it actually makes a big difference. And so that is the big thing I want you to take away from here, is that if you're trying to create gum symmetry, you can't use veneers or crowns to do that. You actually have to incorporate braces into the modality of treatment. Okay, so again, I wanted to bring this issue up, and so if you have any questions or concerns, let us know, and hopefully you'll learn something, and have a great weekend, have a safe 4th of July weekend, and we will see you next time at our next Friday Focus.